So there's a tremendous collaborative spirit, and still exists a tremendous collaborative spirit amongst the hospitals and universities in South Carolina. So they know that the state is in the bottom fifth percentile on most healthcare indices. So everybody feels something needs to be done. There's a passion to get something done, as well as this nice accident of geography that enables people to want to collaborate. So those two things, plus a little bit of money, all come together to make our state particularly useful greenfield site for a major project like this. And so it just took what it's taken as being the necessary, just the right choices to try and get this done. One of those components, and that is enabled by the collaborative spirit in the state, is this concept of a near real-time data warehouse of healthcare data. The concept of 4 otherwise unrelated clinical entities putting all their clinical data into one single pot as a core part of that analytic engine is one of the major goals of our system. So here these are the components associated with it. It is the release of all healthcare data through HL7 interfaces into using an enterprise master patient index to resolve the master data conflicts associated with them, make sure that basically a statewide identification system, putting that data into a real-time operational data store, which is then expressed as a data warehouse, some elements of de-identification as part of that pipeline, and then the expression of that data into a research data warehouse that can be accessed for self-service by researchers for hypotheses generation and that type of thing. This is one of the components of the systems that we're putting together. It's not a remarkable story. What is relatively unique about it is the EMPI at the front end of it and the real-time nature of what we're trying to achieve. But the whole process started with a lot of grant writing. We were lucky. The very concept of this and the fact that we had started our group and that there was funding involved enabled us to get that important CTSA award down in Charleston. So that was a good start to the project. But everybody had to be convinced that we had a real plan, and so a lot of at least a year's worth of thought went into how this got going. And then, of course, once you lay some plans out, the whole vendor selection fest began, and everybody thought HSSC's got a lot of money, and we were inundated with the vendors who wanted to help us really achieve this vision for a price. And so there was at this time there was very much a choice. We could either go with a series of black box solutions, and we had some consulting effort that went in to help us put this all together, or another opportunity was to take open source solutions. So that's the second relevant part of this particular discussion, was at this point a significant choice between, I can't mention their names, I won't mention their names, but the sort of vendors who would sell you a complete solution for this type of, or do we grow it ourselves, and do we grow it with an emphasis on the expertise that we bring in place and a series of open source solutions. And that's I say that we had a number of, not all the vendors are here, but this is some of the examples that we did. We had a very significant vendor selection process for elements like the EMPI, the trials management system, the data warehouse pieces, and we went through that process. We had all sorts of quite wonderful wiring diagrams about how this was all going to fit together, a complete information system in a box. And in fact, in the end, we rejected all of that. Okay, it was a no-brainer. That what was clearly the thing that we lacked most of all was expertise and people, and it was a matter of convincing the leadership involved in this process that was the necessary. We actually had to provide a high-performance software development team and a project management team that could talk to subject matter experts in this field and come to understand it. That would be the platform on which we would then grow quite slowly these systems not from scratch. We're going to develop them themselves. We were going to stand on the shoulders of giants who had already done this in the open source community, or who had quasi-open source projects in healthcare in our area. So one of the major decisions we did make, though, was to purchase services from a company that would be recombinant with very deep domain expertise in this area in research informatics. So that idea there of standing on the shoulders of giants is very, very important for us. We are implementers of I2B2, that's Informatics for Integrating Biology at the Bedside, an open source project, quasi-open source project out of Partners Healthcare. REDCap, which is a consortium of research data capture applications out of Vanderbilt, CA Big, which you heard about yesterday from John Speakman, and Harvard Profiles, which is social networking for scientists, and Shibboleth, which is an open source single sign-on mechanism. So you can see that we had this stark choice: buy it from the vendors or make it ourselves, grow a team. And we decided on the latter, and I think it's been a success. There was another piece of software that we looked at very carefully and actually ended up purchasing, mainly because it had a master patient index associated with it, and that was Java Caps. And we were looking at this about the same time that Sun was being acquired by Oracle, and that actually didn't put me off, because I knew I needed an EMPI at the same time anyway. But what was so interesting about this was its connection to open source. So every component of Java Caps, which was this wonderful collection or stack of applications that seemed to be perfect for developing in a very open way highly messaged medical applications, from a portal right the way through to the EMPI, all based around an ESB architecture. So this was a nice stack from Java. We ended up purchasing this with professional services. But what was also very interesting, and what made me feel very confident about it, were the open source processes that were at the back end of it. If anything should go wrong with this relationship, there was always the open source communities at the back that could help us through it. And you know, if you looked at and looked at this infrastructure, it seemed an amazing integrated environment for building these solutions and putting it together. And I was very attracted by that, and so was the group. We spent a lot of money training and getting into it. So anyway, we started building the systems and growing our team. This is the end part of the story. And we continue to do so. We host our systems at Clemson. We have project management up here in Columbia. We've grown an informatics team down in Charleston. Many of them are actually in the room today. Thank you. And we're in the business of building our systems. So the team itself is now about 26 FTEs, significantly mixed between the CTSA down in Charleston and myself and the group up here in Columbia. And we have at the bottom project management, OBIS, the Office of Biomedical Informatics Support, infrastructure and support, which of course is becoming more important as we roll these systems out, and project management up in Columbia. Some examples of our successes. Let me have a quick look at the time. Excuse me. 10:50. We're very good at building websites, content managed websites, which were the first things we started off with. Research toolkits, content managed, whole compendium of the research enterprise, a resource directory of what's there. That's something we've actually been able to give to other people. University of Connecticut has actually been able to, is looking at that, actively using it. Other applications, quite sophisticated shopping cart applications for services in the research enterprise. Portals for an entire research community. This one uses Drupal but has a nice triple RDF backend and ontology backend that Mark Giles has put together, making it a very, very complex and nice application for that. RedCap, we will use, if somebody's done it, we'll use it, and this is a very good application in our space. It's not truly open source, it's a community. It's not open source at all, I have to say, but it's certainly free software that solves a very particular problem for research data capture in our environment. Just talk a little bit about those HSSC, SSSC tools. This is the South Carolina Integrated Platform for Research, as we call it, and we're beginning to put its components together, that research engine at the statewide scale. And you can see some of those elements there are, I'll just give you an idea of what those wins are. One of them is Shibboleth. There was a spotty implementation of Shibboleth single sign-on software. If we're going to put a suite of these things together across the state, we need to solve the issue of user management, rights and roles management, and Shibboleth will help us to do that. The universities had been early adopters of this, but they weren't fully adopted. And so one of our first major projects has been to make sure that everybody who's started Shibboleth fully adopts it, and those that haven't, make sure they do it, so that we're able to have this mechanism that underlies our suite. So we've made, our team has promoted Shibboleth across the state of South Carolina. Maynard Kane, who won the Galaxy PDA yesterday, has been our major promoter of this across our group. So that's been very successful. And that's an open source project. Another significant win is the building of our CDW. We are actively accumulating data now in the data warehouse at Clemson, These are some of its components. But one of the things it will do, we are accumulating data. We don't yet have the data collaboration agreement signed, but we anticipate that will happen in the next 6 months or so. But we are able to, we have a memorandum of understanding and all the necessary HIPAA business associate agreements in place to allow us to actually accumulate data. And we have the research data warehouse from I2B2 is now available in development. We can demo it. It's much easier for people to see now that we can demo it. And I'm confident that this will come off. Just to give you some idea of what the capabilities of this system, this is a very simple desktop tool in this application called I2B2, where you can drag from the ontology, show me all diabetics under the age of 40 years old across our 2.5 million patients in this system, and show me how big that cohort is, and then subdivide that cohort and see what their demographic. This is a tremendous tool for researchers who want to explore hypotheses and cohorts across the state. It will be one of the tools that leapfrogs South Carolina into a leading area of research. And as we build and add richness to this, it will be a very powerful tool. scresearch.org. We have, probably the next one, this system here. We've been able to, through the efforts of Randy Shelley, particularly within my group, put in place a consolidated IRB system across the HSSC enterprise. So we use a single system from ClickCommerce. That's not open source, I'm afraid, and one day we'll probably rewrite it. But this gives us the capability for all IRBs to coordinate and collaborate using the single underlying system. And that's a tremendous reduction in the barrier for research across our systems. The good news about that is that we now have a registry of all research that's going on. So we're able to express it back out to the community as SC Research. So secondary use of that data, a community-facing page, a registry of anyone to see what research is going on in South Carolina, an immediate benefit and process of that. So thanks again to my team for putting that together. It's an easy sell to the HSSC institutions to have this. Palmetto Profiles is social networking for scientists, so the ability for people to see what the research expertise of and find collaborators. These are the equivalents of Facebook for ordinary folks, but this is ability for you to actually show your expertise to the rest of the scientific community, find collaborators and create teams. So there are a number of quasi-open source projects that do this. One is the Harvard Profile System from Griffin Weber up in Partners Healthcare, and we have adopted that. Our own flavor is Palmetto Profiles, and that will enable, we hope, a flurry of collaborative activity across our state for research.